Students, so we will start abnormal vaginal discharge and pelvic inflammatory disease. By the end of this lecture, you should be able to understand how to perform testing, how to diagnose, and know about the common vaginal infections which present with an abnormal vaginal discharge. You should also know how do we differentiate between normal and abnormal vaginal discharge, to clinically differentiate between vaginitis and pelvic inflammatory disease, identify women who are at an increased risk of pelvic inflammatory disease, and know the management principles for this condition. So, before we start about abnormal vaginal discharge, we have to know what is a normal vaginal discharge. Okay, so but even before that, we have to understand that vagina itself, it does not contain glands, but it is a lubricated organ, and lubrication is very important. So, where does it get its secretions from? So, one of the sources is the Bartholin glands. It is present on the posterior part surrounding the vaginal introitus. So it mainly lubricates the vaginal introitus, which is the vaginal opening. And then another source is from Sikine glands. Sikine glands, they cause, through their ducts, of course, they cause lubrication of the vulval structures. And then there are glands in the cervix where the secretion, they cause a vaginal lubrication. Now, if you look at this picture, so these are the Sikine glands, and Bartholin glands are located posteriorly. So that means if there is a swelling around labia majora or in the labia majora, um, uh, it's most likely a Bartholin gland if it started from the posterior part. But once these glands or cysts this increase in size, then they can also involve the anterior part. So this is just an image of a Bartholin cyst on the involving the labia. So we can see that it is mainly on the posterior part, right? But if it enlarges in size, it can also involve the anterior part. Okay. So it is important to differentiate between a cyst and an abscess. So if cyst is not timely diagnosed, and if it does not respond to treatment, it can convert into an abscess. And the problem is in the treatment, right? So once an abscess is formed, it needs some kind of surgery. Now, what kind of surgery? We will discuss about that. So how does a Bartholin cyst it presents? So and why does it happen? Mainly, mostly it happens because of a infection, and mostly it can be a sexually transmitted infection like chlamydia or gonorrhea, but not all cases are because of chlamydia, gonorrhea, or sexually transmitted infections. Okay. So basically, what happens is when the gland is inflamed, it starts to cause secretions, and once these secretions and this infection can block the ducts, right, draining the gland. So once the ducts are blocked, then these secretions start to accumulate, and of course it causes swelling of the gland, and if it is not treated appropriately, then it can change into an abscess. Now, how do the women present? They may present with, of course, signs of infection. And what are the four classic signs of infection? Now, they may have pain, they will have swelling, it may cause redness, right? So there may be a tender, painful lump near the vaginal opening. They may not be able to even sit. A lot of women, they even find it difficult, pain during walking, pain having during sexual intercourse, and of course, there will be a fever. Okay. And what is the treatment of a Bartholin cyst? So first, if there is pain, usually there is pain, right? So it's just give them analgesics. Okay. We do not need to admit women with Bartholin cyst. Okay, they are usually outpatient. So, and then because of fever, they may be dehydrated. So ask them to drink more. That's rehydration. And then antibiotics. Now, generally, theoretically, the antibiotic of choice is flucloxacillin. That's a narrow spectrum antibiotic. But clinically and practically, especially in the UAE, we do not have mostly flucloxacillin available, so you can use comoxiclave. Okay, and comoxiclave has a broader spectrum compared to flucloxacillin. Now, what is it if it does not respond, or if the patient came late, or if she's resistant to that particular antibiotic, then, or if she's allergic, then sorry, resistant, right? So, and then what is the surgical method of choice? We have different options, but incision and drainage should not be performed for Bartholin abscess. The reason is it is associated with high risk of recurrence, okay, high rates of recurrence. The ideal method for a Bartholin abscess is a surgical procedure. It's a minor procedure, but it's an important procedure. It's called marsupialization. What is the difference between incision and drainage and marsupialization? So basically, an incision is yes made, the contents are drained, but the cavity is not closed. Okay, so then what happens is the cavity is kept open so that it continues to drain. But the walls of the cyst, they are stitched to the surrounding mucosa. You do not need to remember the exact details. Just remember that incision and drainage should not be performed for Bartholin abscess. And But still, does that mean that after marsupialization there won't be any recurrence? A lot of women still have recurrence. Okay, so Bartholin abscesses and cysts, they are known to have a lot of recurrence. Another method, less commonly used, that's by the use of this Wood's catheter. It is just placed inside, and then it is inflated, and later on it is expelled on its own. Okay, so but marsupialization, just remember this. Okay, now how do we differentiate between abnormal and normal vaginal discharge? So normal vaginal discharge, see, like there are secretions everywhere, for example, in the oral cavity, right? Same is with vagina. And there are but particular times when the vaginal secretions, they are increased. Okay, for example, at the time of ovulation, okay, the cervical mucus, it becomes more kind of watery, right? I mean, it becomes more in volume. Okay, and then soon after menstruation. Okay, but normal vaginal discharge, it does not smell bad, it does not cause itching, it is not yellowish or greenish, and it is not pure white. Okay, so, and it should not look like pus like or mucopurulent. Okay, so that means any vaginal discharge which is usually not associated around the time of period or around the time of ovulation, that may be abnormal vaginal discharge. Again, if it smells bad, or if it causes itching, or if it is yellowish greenish, or it looks like pussy like, or it is even whitish, pure white. Okay, so that's abnormal, that's not normal. So that means we divide vaginal discharge into two types. So there are then two types of main categories, main causes of vaginal discharge, which may be physiological or pathological. So in physiological, one of the causes which I didn't mention earlier is pregnancy, and even at the time of sexual arousal. Now, pathological causes can be inflammatory or infective, and non-inflammatory or non-infective. Okay, so in inflammatory and infective, it can be inflammation and infection of any organ in the pelvis. For example, it can be infection of the vulva, which is vulvitis, infection of vagina, which is vaginitis. Cervical erosion is a normal phenomena, but it is associated with actually kind of watery more discharge. Okay, then tuberculosis. So tuberculosis of the pelvis or endometrium, or sometimes fallopian tubes, right? It's a common condition. It's not common, but it's found mainly in countries like Pakistan, India. A lot of women, they have even for infertility because it can cause endometritis or it can even cause salpingitis. Okay, then puerperal sepsis means after delivery, especially if there is an infection or if especially if there is a retained piece of placenta, then it can cause infection. But even retention of placental piece is not necessary, it can just happen. Okay, chronic salpingo-uveitis means infection of the fallopian tubes, and uveitis means infection of the ovaries, and pelvic abscess draining vaginally. Sometimes it happens. Infected cervical polyp. Sometimes cervical polyps can get infected and they can cause abnormal vaginal discharge. Then non-inflammatory, it can be neoplastic like cancers. Spatially, please remember that cancer of the endometrium, how does it present? We know that it may present with abnormal uterine bleeding, right, or postmenopausal bleeding, but it can also present with very heavy vaginal discharge. It can be foul smelling as well. Okay, so that means in an older woman, or even late middle ages, or postmenopausal, if she presents with a lot of vaginal discharge, especially if it smells bad, or just a lot of vaginal discharge, that may be cancer of the endometrium or cancer of the fallopian tube. Okay, and then foreign body, what do we mean by foreign body? Foreign body means, say for example, if a woman had an episiotomy stitched and at the time of the suturing we forgot the count, right? We did not do the swab count properly, and one of the swabs was forgotten and she was sent home, and later on she comes back either with a lot of abnormal vaginal discharge which may be foul smelling, or she may even present with fever or sepsis. Okay, so that's negligence actually. So that's why it is very important to count the number of swabs after episiotomy or any surgical procedure in general. Anyway, so now here in this lecture from now on, we are going to discuss 5 important infections which cause abnormal vaginal discharge. There are many, okay, the list is very long, but these are the more common ones which you should know at undergraduate level. Vaginal includes the one of the common one is vaginal candidiasis, which is actually fungal infection. Then there is one which is called bacterial vaginosis. Okay, that's also a common condition. Then Trichomonas vaginalis, it's a sexually transmitted infection, but it is an important one. Less common, of course, compared to vaginal candidiasis and bacterial vaginosis. Then main two infections which mainly infect cervix, which actually infect cervix, but they of course cause abnormal discharge. So, and then the woman may present as abnormal vaginal discharge. One is chlamydia and second are gonorrhea, and both of them are sexually transmitted infections. So now I will stop here and the rest we will do in the next